All right, welcome everybody. I am Zack Herman, owner of Automated Practice. I have Dr. Nik Andreev here. He's been working with us, and I just kind of wanted to highlight his practice today. So, Nik, welcome. Could you kind of introduce yourself and your practice and how long you've been in business?
Thank you. Thank you for the opportunity. My name is Dr. Nick. I've been in practice for going on year four, so 3 years. We're in Walled Lake, Michigan, just like 30 minutes outside of Metro Detroit. We are a kind of full spine family based practice. See everybody pretty much from womb to tomb. We do chiropractic and soft wave, and it's been a heck of a ride for the past 3 years.
Yeah, so, rewinding time back to, before we worked together, could you kind of tell me, what some of the biggest frustrations or issues that you were dealing with before working with us?
The unknown is always going to be a big factor for like new docs and new chiros, right? So like, what's going to happen next week? Is my calendar going to be full? One of the things I think that we really struggled with was inconsistency, and that was a little frustrating, right? It's inconsistency where we'll have a good week, then we'll have the best week, right? So I think it's the nature of our business sometimes where there's a little bit of inconsistent months, day in day out stuff with people, right? School, vacations, holidays, stuff like that. But that's one thing that really kept me up at night. I think is like, hey, what's gonna happen this upcoming week, right? So now looking back at things, we've been able to, once we started working on it, I think it was when we launched our soft wave, which was last July, and it was a really good fit for us. And ever since then, we've been just kind of rolling and building momentum month in and month out, which has been pretty fun.
Awesome. Yeah, still kind of being before you worked with us. Have you worked with any other agencies prior to this? Did you consider any other options, and what made you go with us?
The biggest reason is just the like I said the confidence that Jeff had when he came over here. He's like, dude, he's like, you got a good thing going. He goes, you got to take it to new heights. Zach's team is one of the best out there, so give him a phone call. So I think we relied a lot on word of mouth and referrals, and honestly, I got two little kids at home, and I got one more on the way. So we were doing a lot of screenings, and just time outside the office in the community, which is great. I think it's amazing. But when you're able to blast out on social media and have thousands of people see you compared to spending 8 hours at a screening and talking to 30 people, right? Especially when you got a family at home that's young, it's a little bit different. And I think that was the biggest things, right, was time management. As we get into this new phase of life, my time wisely, making sure that we are spreading the word of chiropractic, but also making sure we have the personal time at home as well.
Yeah, I have two kids as well. Duran, the partner in Automated Practice, also has kids. And I mean, I told you before this, my daughter's sitting outside my office. And I mean, you start to realize that that's the most important thing. And, obviously you're also helping others. So that's very important too. But just having that time back, especially on the weekends and so forth. I mean, Duran and I talk about it all the time. It's like whatever's happening here, money wise, is great. But having that time and flexibility is everything. So that's awesome.
Yeah. And, like being able to not do two screenings on a Saturday and a Sunday and being able to attend T-ball, right?
Yeah.
That's priceless, dude. So that's been one of the biggest things that I've really appreciated in the last year or so.
Awesome. Thank you. What kind of changes have you seen in your practice since working together? If you have any numbers, that's great. Just curious what changes you've seen.
I mean, I'll go back to the word that I talk to my team about this all the time. It's like consistency, right? Consistency week in and week out, month in and month out. I mean, I have some numbers here for May, June, July, and as far as like new patient wise, we're in the 20s or mid to high 20s every month, and that's consistent, right? You
Awesome.
have months that you boom, which is even better. And another thing I want to kind of say is like when you're getting these new patients, right? That opens up the door for referrals, right? And other family members to come in when you start to take care of people the right way. So I think that's one of the biggest things is these new patients that are coming in, because that opens up the door for more referrals and family members and stuff like that.
Yeah, totally. You can get one lead, and oftentimes we just kind of focus on how many appointments were generated, how many new patients were generated. But then, like you said, there is that sort of spiderweb effect where they might refer, they'll bring in their family. I mean, I've gotten soft wave just because I've been at some of the trainings, and I've gotten treatments and I was blown away with it. So I went to a nearby practice, got treatments. I brought my wife, got treatments, and we're not free, we're paying. And then my father-in-law, he builds houses, and he shouldn't be. But his whole body's broken down. He went to he went to he's in Santa Barbara. He travels 45 minutes to get soft wave treatments, and he's referred 5 people. But when you have such an amazing device in a practice, it helps. And one lead turns to many for sure.
Yeah. I mean, you just take care of people the right way and doors open up, and with soft wave, especially as you just said it, man, the results speak for themselves. You get people in the door, you bring between them understanding what the technology is, and administrating the treatment, and then, they're mind blown and they're like, hey, I know like 3 people that can utilize this.
Heck yeah. Yeah, I mean, once they get that range of mobility, they're like, oh my God, I know a bunch of people that could love this. What would you tell someone that, sort of in a similar situation as you were a year or so ago that might be consider working with us?
Do it in a simple way. Like if you're looking to grow and if time's the most important thing for you, you got to lean on some pros, right? You can't reinvent the wheel. I think that's the most important thing. We heard it all the time in school and coming out of school and into practice. It's like, hey, your systems and procedures, don't reinvent the wheel. There's things that work. Same goes for marketing. There's people who know what they're doing, like you and your team, right? You can't do everything yourself. And especially if you want to free up some weekends to spend time with your family and you're looking for growth at the same time, which is pretty freaking awesome, that have free weekends and grow, I think 100% you got to lean on some pros.
Awesome. Yeah. So this last question can be totally outside marketing, outside working with us. I just like to ask this because you have a successful practice. I just want to know if there's, again, speaking of docs in a similar situation, do you have any tips, any pro tips, any golden nuggets that you'd like to share that could really, that maybe that things that you're doing in your practice that may be unique, maybe just simple, that you could share that might be sort of value for docs in your situation?
Honestly, for me, I think the most important thing about a practice is the day one experience. I think is really important, right? So the day one experience starts when they click that offer, right, through that lead. That's when everything starts. How fast that the team gets back to them, the tone, if it's a phone call, I think is really important. We try to have phone calls all the time. The verbiage, right? And then when they come into the office, the greeting, to the consultation, to the meet with the doc, to if they're getting treatment that day, the treatment on that day, to setting the expectations and knowing what is next. I think people don't like the unknown. So we always make sure that when people are walking in, they know what's next, right? They know like, hey, they're going to come in, they're going to do paperwork, then they're going to get a consultation, then they're going to get, thermography, x-rays, so on and so forth, right? So I think my team does a really good job at setting expectations up before they come into the door. People like that. It's almost like holding their hand through this process, right? And if they don't know what's happening next, chances of them coming back go down the window.
Yeah, that first experience in any business is everything. If there's something weird, if there's something off, if there's unknowns, if the front desk lady was kind of a pain in the butt, the treatment was great, the doc was great, but that first experience is everything. So thanks for sharing that.
I was just at an eye doctor appointment with my wife, and we walk in and not even a hi for like 10 minutes. And I was like, what? This is crazy. Like if my team did that, I'd lose my marbles, and I know that drove me crazy, but I know I'm not alone in that. Like people want to be acknowledged, especially when people are coming into your chiropractic office. Like I think we tend to forget sometimes in today's society we're kind of less resourceful people. They've been through the ringer and they're pretty good for help. When they walk into your door, they're seeking answers and they're wanting help. The more that you're there for them, the more trust you build. The better they feel, the more that they're going to refer, the more that's better for you and for them.
Yeah, I mean, you nailed it too. Like just that first, it's so easy to just be nice and just say hello, how you doing? Especially like you said, for these patients who have been through the ringer. Maybe they've seen a couple other chiropractors and have a bad taste in their mouth, but this is, they'll just give it one more shot. If you just are warm and welcoming in the beginning, like they might be like, oh my God, this is different. Like this was a different welcome at least. So this might be something different. So setting the tone is everything.
I think that's pretty much it. You guys have really kind of helped us the past couple months. And I think with that being said, each office is super different. I think every office is in a different stage. So where we're at right now and where we're growing is amazing, but there's also things that we want to implement and change at every stage of our office, right? So I think we talked about it before. I think your team does a great job in that, and you guys are always open to kind of seeking out different ways, which is all you can ask for, right? If you can't just continuously do the same thing over and over again, right? So
Yeah, thank you. Yeah, we're very big on just not treating everyone like a number, and every practice is different, and so we value your guys' ideas, and we your patient better than anyone, so we're always open to hearing that, always open to collaborating, and then obviously but then there's, like you said, hire the pros. So if there's things that are just out of this world, we'll say that's probably not going to work, and here's why. But we always respect opinions and take it into heart. And honestly, you might have a small conversation with Gabrielle or one of the team members, but that enters a team meeting. We all discuss it. We all collaborate and take that into heart, and then, spin up some new campaigns. So yeah, I appreciate you seeing that. Well, cool. That kind of wraps it up. Dr. Nik, really appreciate your time.